Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Hi, I'm Laura Guidi with Cardiac Rehab at West Tennessee Healthcare, and we're here today to talk about our heart camp. And with me, I have Dr. Eric Sievers.
Hi.
And I have Bonna Gollihugh and Susie Tucker.
Good morning.
And we are here today to talk about something new that we launched back in September about our heart camp. And it was something that was a vision we saw a few years ago. We saw that the population around here that was having heart surgery needed to be more educated on their heart journey and get them more involved and to know what is expected when you have heart surgery. So that's what we're here to talk about today. And so I was going to ask Dr. Sievers to talk to us a little bit on what he has experienced and how we hope this goes in the future.
Well, thank you. First off, we're really excited that we got this program off the ground. It was a lot of work by a lot of people, and it was really based on trying to get patients and families prepared for the experience of surgery. Our colleagues in orthopedic surgery have a version that's been matured, but when people talk about operations on their heart, they think of emergencies, they think about right away, they think about has to have it done. Oh my gosh, I need this now. And what we've learned is that our patients do so much better when they're prepared emotionally, physically, for what they're going to experience. And our outcomes attest to that. So the idea behind Heart Camp was to try to put a organizational framework around the idea of getting ready and prehabilitating for heart surgery.
Absolutely. And we have, through the years, working here at West Tennessee Healthcare and teaching patients about surgery and what to expect, you're really scared. And a lot of times you don't understand that this is a short phase of your life, and the more that you are prepared and your discharge begins before the surgery even starts. So that was a goal that we had and a vision that we had. And so when we started talking about it and changing our education and the approach, we thought what a great idea it would be to bring the patients in with their support person just to see how it would help to educate them before coming in. So we brought this to one of our other people that work with us. Her name is Susie Tucker, who is also a respiratory therapist and has worked in education in many different areas throughout her career. So she said, I really think this is a really good idea. And we worked very closely, as Dr. Sievers said, with our orthopedic group and developed our model by theirs because it was working. So if something was working, we thought, well, why can't it work for us as well? So Susie, I would like for you to take a little bit of time and tell us what you have experienced since we have started this program in September and what challenges we've kind of overcome.
Yes, absolutely. I had the opportunity to become involved in this relatively early on. The need is there. So I feel like if we can begin to prepare not only our patients, but their families, their support person, their caregiver, the person who's going to be with them throughout the journey, if we begin to prepare and set expectations on the front end, not only as stress, the patient's relieved from the stress and the family as well. So our goal in Heart Camp is to begin to shed some light on the diagnoses and the surgical aspect, what that looks like, all the way from understanding the procedure the role of the support person, the need to establish primary care. That's really super important with any type of heart surgery. And then the need to begin to prepare for discharge. We talk about discharge early on in the process once our patients are medically stable. And we want to make sure that we have a plan in place early on to transition those patients to home, skilled rehab, or outside lying facilities if needed. So education is first and foremost. We begin to set expectations. What does this hospital stay look like? What does this surgery look like? What can I expect? How long am I going to be in the hospital? What are some things I need to know when I go home? How am I going to care for myself? Things like that, all the way into the rehabilitation process and following up with ensuring the patients come and they have access to cardiac rehab facilities that are close to them logistically. So that's kind of pretty much the high-level overview. We kind of begin to start, like I said, setting expectations, know what to expect, help to relieve stress on the family, and prepare for discharge at heart camp.
And Bonna, on your side, I know you see the patients before and then again after surgery. What have you been seeing that's a good outcome that you've seen from the heart camp?
Hey, well, I found that patients, when they are educated prior to surgery and well educated, that they do better. They know what their expectations are. They know what their recovery is going to look like. They know what to look for when they get home. They know when to seek care, and they end up doing better. They have better outcomes. They recover better. They are not overwhelmed by the education they receive at the hospital, 3, 4, 5 days out of surgery, and they have this book, this guide to go by, and I find that they just do better. I've talked to a lot of patients several days out of surgery, and they've just told me how helpful the book is that they've gotten from heart camp. I just think it's been a great resource for patients, and I find that it's been an awesome thing to have here at West Tennessee Healthcare.
Yes, I'm really excited where we have started and where we plan to go in the future with this. We've made lots of changes. We started one way, we went another way, and I think that has become really a staple piece in the pre-op of a patient or the preoperative phase when the patient is getting ready to go to surgery. Dr. Sievers, what are some more things you'd like to see come from the program in the next few months, a year?
Well, I'm just really impressed how far it's come. What always strikes us as physicians is how surprised our patients and families are that they're going home. They're getting better. And while a few families are very prepared, and that's sometimes their first question is, what am I going to need at home? Am I going to need a hospital bed? Am I going to need, one of those toilets that sit by my bed? And some families and patients have real anxieties of what they might expect on the other end of an operation or heart surgery. But some are just surprised that I'm actually going to go back to my house. Can I do it? Am I going to be okay? And just to help give a patient and their family some framework that, you get through this and you go home. And the day after, when you go home, it's back on the patient and their family. It's, it's back in the ball's back in their court, and give them the tools to make that transition is key.
Absolutely. And something that you mentioned early, people they really see, they're scared. They don't know what to think. How am I going to live? What should have, what could have, what is going to happen to me? And when we bring them in, we actually bring them into a live environment where the people have already had heart surgery. And they can see that these people are exercising, that they are going on with their life, that this is a very short phase of their life. And you too will get past this. But the more prepared they are and that they can see that their life will go on, that this is a very short pace, it's also very comforting to know that they are not alone, that they can see this. And it does help them mentally, physically, and socially, being around other people who have had the same type of thing that they're going through.
I mean, this really grew out of the, your fantastic program of cardiac rehab here, but we have a gap between when patients leave the hospital to when they get to start real cardiac rehab, and it's long. It's often 5 to 6 weeks before patients can get started into that. But what are they doing in that downtime? And there's so many questions, so much confusion. Realizing, hey, I've had heart surgery, but man, now I have to really start to take care of myself. Do I have a doctor? Do I have a primary care physician? Do I have a practitioner who can help me out? Who do I call? Do I call my nurse practitioner? Do I call my doctor? Do I call my surgeon? All those things needed some structure, and Heart Camp is what is our framework now to move forward, and I think it's just awesome.
Yes, the patients have that one person that they can go to, and they can call them, and it's almost like they have their own personal heart friend if they have questions. And it's not just one person, it's a whole team, but you have that one contact person, and it makes the patient feel so much more at ease when they know that they have that comfort. Susie, what are some of the questions and things that you get asked, and how you've helped prepare these patients for their surgery?
Good question. So initially, right out of the gate at a Heart Camp, we start talking about the transition home. You walked in here today. Our goal is for you to walk out of here. And we start talking about just returning to a normal lifestyle. Like, you are now, after heart surgery, you are a heart patient, and you will be a heart patient for the rest of your life. But let's begin to put the tools into place for you to manage this. We start talking about, exercise, risk factor modification. Know your risk factors. Let's talk about those. Let's identify those. Exercise. Exercise needs to be done for the rest of your life. Engaging in a heart-healthy lifestyle, meal planning, diet, healthy eating, all of those things. It's just really a good time to kind of bring things back to bases, I think you could say, and begin to embark on a heart-healthy lifestyle.
Perfect.
And I also would like to add that this Heart Camp that we put our patients through, it allows them to be empowered to participate in their own care. We don't want our patients to feel helpless and like they can't do anything. And I think it's a great resource for them to take charge, to take control, and to empower themselves to take care of themselves.
And in addition to that, Bonna, to know there is life after heart surgery. There is life after heart surgery.
And it's really good for them to know that they can actually be better than they were before.
Truly. Healthier you.
Bonna's background is in the post-operative recovery phase. Bonna's got years of experience out on our A2 telemetry 4, and she took care of the patients on our first, second, third, fourth post-operative days. And I'm sure you've got some patients or families or experiences where they were surprised that they walked the morning after surgery and they were moving better than expected, but yet when the physicians and doctors came into the room to say, okay, you're ready for home, there was a panic and a shocked look on everyone's face, like, aren't I going to need inpatient rehab or home health, and what does that all mean? Can you share any thoughts on some of those experiences?
Right. So patients are often very surprised by how hard they are pushed the very day after surgery. The next day, they're up in the chair. Physical therapy is working with them, and if they're stable, they're walking out of the unit into their room on the step-down floor. And patients are surprised and shocked at this time. Their families are surprised. And by setting the expectations that they will be asked to do this after surgery, it kind of takes away some of that shock. And as we've discussed before, these patients are overwhelmed. They're shocked from just having open heart surgery. Their families are in shock. And by establishing this education prior to, we can really enforce the education. We find that if they're learning prior to the surgery, they do better. They remember things more. They know how to take care of their incisions when they go home. They know how to watch for signs of complications after surgery. They know what to watch for. They know when to call us and let us know something's going on. I'm concerned. Can you help me out? What do I need to do? And that's part of my job, is to kind of guide these patients through the postoperative phase, to either bring them in to see us in the office, to send them to their cardiologist, send them to their primary care doctor. And having that expectation, that knowledge that they can go to me, go to the nurses at Cardiac Rehab, they have those resources and they do better, and they know that that those people are there for them. Like we've talked about many times, it's a support group for these patients.
Absolutely.
That's interesting, Dr. Sievers. I always mention in heart camp, it is our goal. It is our goal that you walk with assistance out of the CV, ICU, around to the step-down unit. That's a goal. And they always look at me like, oh, that's so exciting. I'm going. And I'm like, yep, that's a goal with assistance.
And it still amazes me that sometimes they're still surprised that we're going home. And of course, that's our goal. Our other big portion of heart camp is taking the patient. Not every heart surgery is an emergency, and not all of it has to happen right today. When you have that luxury and you're not an emergent patient, the time spent preparing on the front end makes such a difference. And sometimes they come to pre-op or preoperative process with such anxiety about, can I wait? Is it okay? Why aren't I having heart surgery today? And reinforcing that it's a process, and that are getting some basics, some healthy teaching on the front end before surgery makes for a better journey and recovery. Things as simple as knowing that you have a primary physician, knowing that your diabetes is under control, knowing that maybe even smoking cessation, even for half a day, makes a huge difference in how patients do from the lung standpoint. Shortens their ventilator times, even if it's half a day, even if it's a day, and giving them a place where they can hear that on the front end, that, I could do something positive that might impact how I do, and getting some buy-in from everybody.
Absolutely. And we also have a local organization that has helped get this program off the ground, and we want to thank them so much. It is called Friends of Heart. And a lot of the members have actually been heart patients themselves we want to keep our money local so that we can offer programs like this for our community and surrounding counties. So I'd like to say thank you to Friends of Heart for supporting us and helping us get this program off the ground, and for sponsoring our wonderful heart camp booklets. And if anyone ever has any questions about heart camp, you can feel free to contact us at Cardiac Rehab, and our number is 731-541-6317. If you are scheduled to have surgery, the office of the CV surgeons, Bonna, is available.
Yes, our number is 731-541-3310, and you can call us with any questions, concerns,
don't forget, Friends of Heart is online. Friendsofheart.org, O-R-G, is a fantastic resource for supporting local cardiovascular care and trying to keep philanthropy and funding here locally in West Tennessee.
Heart Month is upcoming in February. February is our National Heart Month. Please go to WTH.org to find a list of events for upcoming opportunities for Heart Month.
I'd like to thank everyone for being here and thank everyone for tuning in to We Talk Health.